Welcome, everybody. I know most of you are from within the AMR Accelerator and others are from within our broader network. I'm Frederik Deroose from Connecting Pharma. Happy to be your host today on this public webinar. We have a very interesting topic and very interesting, impressive list of speakers. Yojana, Andrea, and Phil from the Fraunhofer Institute. They have been working extensively with a larger team on machine learning tools, then specifically applicable in antibiotic drug discovery. So I hope you will enjoy this meeting. It will be interactive. So for now, please use the chat box. If you have any questions, you can just say, I have a question, or you can pose your question. So we'll definitely make sure that there is time for Q&A. And then if we just go to the next slide. So what we'll have is a mix of presentations. So Yojana will start first, talking about the data set generation and the modeling. Then Andrea will go more into the chemoinformatics part of things. And then Phil will also talk about the model validation and maybe also some of the next steps. And then we'll certainly make sure that there is a Q&A. We also have a little poll prepared where you will also, well, I hope you will also contribute your thoughts. You will see it at the end where we'll ask the audience a couple of questions as well. So yeah, so please mute yourself and then use the chat. And I will give the floor now to Yojana. Welcome.
Thank you so much. Okay, so let's dive in. So the first part that we talk about in this webinar is about dataset generation. We already know that a lot of public data exists, and this data is so much that we would want to actually go back, look at it, and see if how we can use this data for our purpose. Specifically in the context of antimicrobial resistance, so AMR, what we want to do is check if we can collect the data systematically and see if with that data, how fair it is so that we can build machine learning models on them. To get a quick overview on how many data sets around AMR exist, what we did is do a quick survey on the internet, so use Google, and to find out what exists out there. And of course, one of the biggest resource, JPI AMR, has a full list of catalog or a platform, which they call the AMR data platform, which has all the information that you need with regards to surveillance data, for example, or chemical libraries that are in the AMR industry, or also about educational insights into how you can develop antimicrobial products. But something that we found was lacking in this is the existence of any preclinical or clinical data set. And this is where we found that we as data scientists could help and bridge this gap within the AMR domain. And what we did is try to take a systematic approach at finding these data sets. If you look at the preclinical data sources, there are more than 100 data resources that actually exist out there, which help you for different purposes. What we wanted to do is look at just small molecules or biologics in general, and wanted to see how much of information we can actually capture from these resources in the context of AMR for these. Of these 100 or more than 100 resources, we identified 6 resources, namely Chembl, BindingDB, PubChem, CoAD, Drug Central, also datasets from the Pew Trust that could actually be beneficial for us to be a starting point to this AMR drug discovery. Within these 6 data resources, what we wanted to do is do an effort to actually verify all of the data that is there. And this takes a lot of effort because what you have to do is for each of the resources, you have to first check what amount of data they have, how the data is formatted, which standards they use, and so on. And that's why we came up with a list of criteria on how we would actually go about verifying this data set. For these 6 resources, since we were focused only on the antimicrobial activity, we first said that we just restrict collecting bioactivity data that talk about microbial strains that could include both bacteria and fungi. Next, we said that now let's look at endpoints that are specific to a activity or a specific experiment type. In this case, we used MIC, so minimum inhibitory concentration, as one of the endpoints. And just by these two resources, we actually filtered out from these 6 resources just 3 resources that could be useful. The remaining 3, for example, PubChem, BindingDB, and Drug Central, were actually not so useful for us in this case because either they had just a single data point that was available everywhere else, or they had no microbial species assays that could be essential for us, or they lacked some curation which increases the burden on doing a case by case analysis of each of the assay results to actually make them fair. So we started by looking at standard and structured data resources such as Campbell, COAD, and Spark. And for these 3, what we did is harmonize all of the information with respect to bioactivity data into that they have all of the units that the assays report is microgram per milliliter, because this is one of the largest experimental value that is reported across data sets, and that the endpoint of these assays are actually a exact value rather than saying that this is a greater than or less than value. With this systematic and harmonized effort, we built the antimicrobial knowledge graph, which we call as the antimicrobial-KG. This KG basically connects all of the 50,000 compounds that we have collected through these 3 resources, connects them to bacterial species in which they have been tested, and to keep the provenance information from where we have got these relations, we also add in the values such as p Campbell value, which is like a standard value, so that all of the assays and experiments you see in the database are comparable to one another, as well as the source of the database through which they are coming from. These sources could be direct links to their database or links to the assay information as well as the publications that publish about these. Along with these 300 bacterial species, what we did is a manual curation of all of the species into certain categories based on their types. And these are well-known 4 categories of which we call as strain classes, which are gram-positives, gram-negatives, fungi, and acid-fast bacteria. With this whole process, what we did is build up the data set for a fair format, in a fair format. The next step was to see if the data set is in a fair format, can it actually be used to do model developments or machine learning or train machine learning models. And this is where we move to the next segment, which talks about model development. As you would know that each of the compound is not just tested against a single assay or a single species. There would be compounds that have been tested across multiple species for their broader applicability. And these figures also show that in all of the databases, you would at least find more than one compound that has been tested across a span of these strain classes. And this adds a bit of complexity for the machine learning model to understand how you would use this data. And that's why you need to take a tuned approach to actually build a training set. When you're looking from activity standpoint, you need to take 2 things into consideration. First, that for the model to be for the data set to be interpretable for the model, you need to make the data in the form that the model understands. In this case, what you need to do is first try and find out a threshold in which you can consider compounds to be active and inactive in our case, so that we know whether a compound is active for a specific strain class or not. And next is to find out a way in which we can reduce the complexity of this data set into a one compound, one strain class format. For classifying compounds into the different strain categories and seeing if they are active in a specific strain or not, we leveraged more on the log concentration values, which we call as the PMIC values. When you look at the distribution of the PMIC values in the dataset, so for the 50,000 compounds, you can already see that there is some part of a normal distribution. And for us, we just chose an arbitrary threshold of 5, saying that all the assay endpoints or compound assay strategies that show a cutoff of PMIC less than 5 would be considered as inactive, and those that are above PMIC of 5 are considered as active. So this way we can cluster now compounds into active and inactive classes. Moving towards now that we have the active and inactive classes, can we now try and decrease the complexity of this whole data set into a single endpoint where it says one compound is active against a particular strain class? For this, we use the max value concept or max value approach, which basically is also equivalent to a best of 4 result class, where you create a grid form, as you see here, where each of the compounds has reported activity against the 4 bacterial strains that we have. And what we do in this case is get the highest activity value across all of the strains and get a selective class based on this. Here I demonstrate a few examples. For instance, in the first case where you have just a single value or a single result, in this case for gram positive for a compound, there is an inherent assumption that it's going to be inactive for the other classes, although this has not been tested. Keeping this assumption in mind, we classify or we cluster or put the compound in the bucket of gram positives. In cases where you have multiple values or multiple assays being tested for the same compound, again, it's the highest value that goes to it, and also it's the active inactive distribution that, as I mentioned. So since it is active for acid fast, the class is active acid fast. In the cases where it has multiple and the value that you have for the PMIC is higher and inactive, so the class here is inactive rather than it being a fungi class. And this way we are now able to classify each compound or put each compound in the 5 buckets that we mentioned earlier. Now that we have the chemical class as a label that we want to predict for new compounds, we now have to focus on the compounds, on how we want to represent these compounds for the model to understand. The classic approach that we used here is converting these compounds into something called as fingerprints, which basically is shown in the figure on the right, where the structural features of the compounds are represented in a vector form, allowing the model to understand what structural features are there in the whole compound. These fingerprints are represented by multiple types. In our case, we tested 5 different fingerprints. Here we have ECFP4, ECFP8, we have the RDKit fingerprint, we have the MAX, we have MHFP5, MHFP6, and physicochemical properties, just talking about how polar or what's the log p value of the compound in general. So now we have the compounds represented as fingerprints and we have the labels to predict. The next thing that the model that plays an important factor when generating a model is the class distribution. You can see in the table on the top right that for the compounds that we have in each of these 5 buckets, there is a disproportionate. So there is an imbalance between the classes or the compound distribution. And that's why it is essential for us to balance out this imbalancedness, because if there is imbalancedness and when the model trains it, there's a high probability that it's going to put everything in the same bucket as the majority class. To balance out this disproportionality, we used a method called as MOD, which is basically a synthetic sampling of minority class. In this case, acid fast is the minority class, so it's going to generate synthetic points in the data space of the acid fast compounds, such that the number of compounds that acid fast has is equal to the number of compounds that gram positive has. And in this way, all of the classes will have equal number of compounds, some made from pure compounds that have been tested from our dataset, some from a synthetic dataset. And now that we have all of the data in the same form in all of the buckets, what we do is split this big data into multiple sections so that we can train better models. Specifically, we split them into the train, validation, and test set with a 60-20-20 ratio. And for us, the train and the validation set are important because we can use this for hyperparameter optimization, which is basically trying to find out which space in the machine learning model would be best for the current state of the model so that it can do better predictions. Talking about machine learning models, the pipeline that we used is shown in this slide, where we start with the fingerprints of the compound, and then we train a cohort of models, so not just train a single model, but a panel of models that could be classic or advanced models, and use this panel of model to actually do a evaluation and comparison on which combination pair of fingerprints as well as the model performs the best. And once we have the best model, what we do is hyperparameter optimization to find the final model that can be used for predictions. When talking about cohort of models, in our case, we used 6 different classical models, including random forest, XGBoost, gradient boosting, decision trees, logistic regressions, and naive Bayes. And across these 6 models, we tested all of the fingerprints that we had mentioned earlier. And here you can already see that there's a consistently high performance being given by the blue and the green bar, which is the random forest and XGBoost, irrespective of the fingerprint choice taken, as well as for us, the MHFP6 turned out to be slightly better than the other models. And that's why we use this combination of MHFP6 along with random forest and XGBoost to basically do hyperparameter optimization. In the optimization, we found out that random forest is working the best. And here you have the results for the random forest, where you can also see as well after the hyperparameter optimization that the random forest MHFP6 fingerprints is just performing slightly better, just above the RDKit and max fingerprint. And the accuracy is about 75.9%. And on the right, you see the confusion matrix for this fingerprint model. In this confusion matrix, it's already shown clearly that the diagonals, which are basically telling you how good the model is able to predict a particular class for the test set, and how is the actual class looks like. And you already see that it's more than 70% for majority of the classes, and this gives us a bit of confidence that the model is able to perform better on the current test set. But we have not just built the model from the dataset. What we've done is gone back and looked at how we can actually use this model to get more insights. And this is where Andrea will dive deeper into how we gain insights from these models.
Thank you, Yojana. Hello, everyone. You can imagine that in this 53,000 compound, there might be several chemical classes. And one thing that we did is just exploratory to see, okay, which are for each class strange compound. How can we define strange compound? There might be some structural alert, and we found not so many, meaning that the compound that has been assayed and found active or inactive, they were pretty well curated. But, for example, if you look in other alerts, like, for example, QAD analysis is just drug likeness, or you can have how many rule of 5 violation per class you have, like in the bar chart on the right side. You clearly see that, and this is evident from QAD, for example, the compound with no alert is roughly always 1/3 of the complete data set. What does this tells you? I mean, QAD is drug likeness is a general concept, has been very highly debatable and highly debated. And so what does it mean to be a drug? And when you think about antimicrobial, you clearly see that they at least 30%, at least 60% of them cannot be really qualified as a drug in terms of classical drug. because this drug likeness comprehend all the possible mechanisms of action of activity, and so you have a landscape of protein target, which is mainly human. And in this case, we are not in the same landscape of protein targets. There might be some overlap, but this is an evidence science that we are talking about a subclass of drugs which has nothing to do with the human protein, but more to do with bacterial protein. And so bacterial protein might have a different chemical space where no alert can be set. And so there might be a future target to try to find out the drug likeness within the antimicrobial. For the next slide, what we did is to do again a certain kind of exploratory data analysis. We were looking more in molecular weight or in fraction of sp3 carbon or TPSA or log-P. These are just one of 4 of the many that you can actually explore. But these are interesting because the first one, the molecular weight, you clearly see that these are small molecules, always bridging between low hundreds and thousand. No specific subset according to the strain activity or the strain class has been defined. With TPSA, you start to see something else. And for example, you have an average value for TPSA, which is higher for gram-positive and lower for D inactive. This is counterintuitive because usually TPSA has been associated with the cellular permeability. But again, we are speaking about human cell permeability. And so usually lower TPSA should be more permeable. And this is also one of the cutoff for the blood barrier permeability that usually are taken into account. Okay, once say below the 90, the probability to get into the brain is higher, and this seems not to be the case. So, or better say, the activity against certain strains are Gaussianly or normally distributed, but well beyond 90. Interesting. So gram-negative, where you have double membrane, they are pretty small in TPSA, and this I suspect has to be sort of accepted. There are a spike around 10 at 100, and so there might be some class of gram-negative which are a little bit bigger or possessing higher TPSA. Interesting enough, also the fraction. Usually the fraction of tetraedric carbon has been historically taken as a proxy of structure complexity, or better say, non-planarity. Okay, within the drug landscape, the subset of kinase inhibitor, for example, or the subset of adenine or base pair analog is so vast that, and also the chemistry around aromatic group has been so advanced in the latest year that synthesis of planar compound easily crystallizable and easily synthesizable has been pushed this fraction pretty low. Okay, in this case we have a different trend. For example, gram-positive tend to be more than 0.5, so 50% of the atom are more present or tetrahedrical and not aromatic, so aromatic are sp2. And this would be another way to go a little bit more in detail about this relationship between structure and activity as we have defined. So, and interesting enough, between 0 and 10, you have everything in log P. So, meaning there are a few compounds which have negative log P, calculated log P. And so, apparently, we are not, the ballpark of the solubility or the lipophilicity of this compound is not totally different from what we usually know. Rule of 5 point at 5 as a maximum log P, and there are other evidence that log D below 5 is better to be a drug. In the next slide, we can see we have tried to, now that we have a model, or better, more than one, XGBoost on RF, when you're looking to try to explain what the model tells you, but you are using a fingerprint, structure fingerprint as a describer, as a descriptor, it's very difficult to get back to the component of the compound that this is mainly influential to the positive outcome of the model. But if you take the model built on the chemical physical descriptor, this chemical physical descriptor has been calculated, and then all the profile of the molecule can be mathematically reduced to the same vector of 0 and 1 bit, like all the other structure, but each position is derived from a precise chemical physical descriptor. And not surprisingly, we have seen TPSA and S-log P. If we plot the most influential, the top 10 most influential descriptor in chemical physical in the model, we have TPSA and S-log P very high, and then smoothly down fragment complexity, which is something I wouldn't say similar, but conveying the same kind of message about fraction of sp3, of carbon, tetrahedric carbon. We still have largest pi chain. That means that also the aromatic component is not lost. And then we have also molecular weight and other things. So TPase, Labute, ASA can be really well heavy correlated to TPSA, for example. So there are situations where the importance can be over-evaluated or under-evaluated. But this is something that you have always to take a little bit with caution, because number of atoms, for example, is correlated to the molecular weight, of course, and largest P chain with the largest chain is also on the same kind of topology of the molecule. And so, but all in all, we have also tools that allow us a little bit to look into more detailed explanation of the model. The next one. This is an exploitation in a little bit more of detail. We are not looking at the top 10, we are looking at higher number. This is a neat map display, meaning that on the column there are the 5 strain class and with the inactive. And you can clearly see that there are, for each class, before we look into the general aspect of the influential descriptor. Now we can look more in detail. And so, for example, in the very first 6 parameter, they have a clear, evident message for us. So gram, positive or negative, differentiate from acid, fast, and fungi, and inactive pretty well. Being red against blue, so having positive or negative contribution. But even more interesting is that we can also differentiate between gram positive and gram negative when we look into saturated ring, aliphatic ring, and saturated heterocycle. So while the opposite is true for log P. Okay, so this is something that we would like to showcase with some example. We are going to write a paper about this, of course, and so there might be some interesting notion here to extract from this display. Next one. Okay. What we have done so far for disseminate these resources. So the fact that we have several models with several descriptors and several algorithms might be of interest for you, for the user, in order to do what? To do prediction. And so wherever we have a one-stop shop where all this model can be eventually disseminated and implemented, we thought that it could be of value within the AMR accelerator. And you have here the link that can be used. This is sort of GUI where you can choose several data set or to see where we are started from, and also to do some prediction about new compound. This is because we think everything is also in GitHub eventually, or in Zenodo, and so this is the attitude is to make these resources as open science, in some extent. I think it was my last one, if I'm not mistaken. No, this is something that can be eventually also look into this web page. Is not anymore on the prediction side, is again in an exploratory. When there are ways, especially for using this MHFP6 fingerprint, that allow you to generate 3. Okay, so the compound that possess same subset of fingerprint that might belong to the same structure family. And if you color this compound with the class that we said them belong, so according to the activity, you can clearly see there are ways to identify real structure. But it's also true that there might be some subset of this class, of this family, they may have totally reverse selectivity. We can discuss how much selectivity is, because we have identified just by max activity. So a difference between 8.5 and 8.3 might means nothing. But again, this just means that you can find potential active in class that has never been touched or never been assayed, for example. Okay. Or if they have been assayed, that you have a very close activity, and so you can eventually design something else there. And this, I think, is still a part of the website that we have put together. And now I leave to Phil for the next section of the presentation.
Hi, everybody. Hopefully you can hear me okay. So next slide. Yeah, so what we wanted to do is that now we've developed a model As you can see, it's been built on a whole series of public data sets that on our side we've harmonized and verified and then fed them into structural parameterization, and we've gone through a fair amount of effort to do that. But what we wanted to see was, well, how will this act in a real world setting? And in this case, we decided to choose some data that had been generated by the EU OpenScreen community. So I'm also, in addition to working in the Combine project, I'm the Director General of the EU OpenScreen Research Infrastructure for Chemical Biology and Screening. And just to give a quick background on that before we go into some details, it's a network of over 30 partner sites representing 11 countries, and within those partner sites, there's those involved running high throughput screening and medium throughput screening centers and assay development centers, as well as chemistry partner sites whose job is to take hits from screens and develop them into leads and preclinical candidates. And complementing that, this year there's been chemoproteomics and spatial MS-based proteomics for doing mechanism of action determination for some of the compounds as well. And you can see those sites are set across Europe. But I think the important thing about it is that we also have a database host, and this comes from the fact that as part of the research infrastructure remit, we want to ensure that all of the results that are generated within the network are ultimately made available to the wider scientific community, and we do that through something called the European Chemical Biology Database. Next slide, please. But first, maybe to just talk a little bit about the library. So within the network, we host a library in Berlin, and there's a comprehensive compound management facility in Berlin. And the EU OpenScreen library is approximately 100,000 compounds, which are mainly selected upon the principles of diversity. Those compounds have been highly quality controlled, and we know that 95% of them are better than 90% purity, for instance. And those compounds are shipped to each of the sites, and they undergo a series of analysis and profiling within what we're calling our bioprofiling activities. And this is 15 different assays. Some of those assays are looking at very simple things like the solubility of the compounds. Others are looking at more complex readouts, such as their effect on cell viability. But in this case, there was also assays which were looking at the antibacterial and antifungal properties of these 100,000 compounds. Now, in addition to this diversity-based library of around 100,000, there's also a set of bioactives, and you can see those on the bottom right, and that's about 2,500 compounds which are active against 1,000 different targets, and that includes a variety of human and also bacterial and antimicrobial targets as well. And they also include about 650 known drugs, as well as selective probes as well. So those within the EU OpenScreen setting, those compounds have been screened in these bioprofiling assays, and those data have been recently made available, and there's a being deposited in the European Chemical Biology Database. So next slide, please. And this is the database itself. Anybody can go and look at it. It's the ecbd.eu, and it's got at the moment a nearly, in terms of visible data points, about 3.7 million. I think it is maybe slightly out of date, but there's also including compounds which have yet to be released. They're within an embargo period of up to 3 years, where there's an additional approximately 1.5 million data points. So there's 5 million data points, and within there, in terms of our specific needs, there's a number of antimicrobial screens have been run. You can find out more details and information in a recent paper in Nucleic Acid Research that came out. I think it's came out at the end of last year, but I think the paper itself came out just a few weeks ago in January. Next slide, please. So these are the 7 organisms that were assayed as part of the EU OpenScreen bioprofiling efforts. The screening concentration was 50 micromolar, which is relatively high, but that sort of reflects the fact that, you know, relatively the activity of the compounds, they're just screening sets, so you would expect the overall activity to be relatively low in most cases. So it's screened at a slightly higher concentration, and you can see that they were screened in MIC assays in against a variety of organisms representing fungi, gram-positive, gram-negative pathogens. Next slide, please. So here's the activity distribution within the various screens. All of these data are available for download. You can download them yourselves and also use them as part of your own research and then compare them to your own results. You can also get all the information. There's a fair data set associated with each of the compounds. So where there is available public information, you can find links through to the structures and any information about the compounds in ChemBull and PubChem and elsewhere. And so we were able to, we classified the activity of the compounds into being active is above 50%, inactive below 50%. So it's fairly arbitrary, but in line with the feedback from the screening teams who are involved in generating the data, who are also part of the ultimate paper. Next slide, please. So here you can see the predicted probabilities across the two libraries. And I think what's quite interesting is that the predictions, the number of predicted active compounds for the larger library is relatively low. And I think that reflects the diversity of these compounds. These compounds were not specifically selected to have antibacterial properties, antimicrobial properties, whereas with the bioactive library, again, using the model, you can see that there's a much higher proportion of the compounds are predicted to be active. So overall, the bioactive compounds, obviously, they're more drug-like and lead-like compounds, and then they fit more closely into the chemical space, which is being utilized by the model training set. Next slide, please. So you can see for the ECBL library, which is the 100,000 compound library, that the great majority of the compounds were predicted to be inactive. And the approximately 4% of the gram-positives that were predicted to be active and 2.7%, etc., of the acid-fast, and a lower number for the fungi and the gram-negative. I think it's very interesting to see for the bioactive library. Again, these are compounds which are closer in structure to the training set that was used within the model creation, that approximately twice as many compounds were predicted to be active, with the largest proportion being gram-positive and 3% as antimycobacterium, antifungals, and gram-negatives as well. So next slide, please. So this is the sort of really where you're really trying to see whether does the model work or not, and it's got a it's not fantastic, but it's I think a reasonable improvement on just random, as it were. So what you can see here for gram-positive, gram-negative, and fungi strains, on the actual model hit rate is 1%. So in the first one, for instance, what's in the bracket was the hit rate within the screen itself. So disappointingly for gram positives, we can only for the large collection, we can only pick up 1% of the 1% of the hits. So there's no real benefit associated for this very large collection. There's no real benefit associated with the model. However, when you're dealing with a compound set of the bioactives on the right hand side, you can see that you're beginning to get enrichment. So whilst the actual hit rate within the screen was 6.3%, by just screening a few percent of the hits, sort of theoretically, we're able to pick up 15% of the compounds. And that gets even better as you go further down to the gram negatives. So in the gram negatives, the hit rate was 1.06%, and by screening 2%, if we had just picked up the 2% that were predicted as being active, we would have picked up 10% of the active compounds that actually appeared in the screen. So we have a five-fold enrichment. I think, but what's extremely interesting is for the antifungal compounds in terms of the bioactive set. So here the hit rates that will be predicted, well, the actual hit rates in the screen are 5%, 3%, and 2%. And the hit rates that were predicted by the model were about 2%. So that means what that means in practice is that if we'd screened those 2% that were predicted to be hit rates, we would have picked up over 40% of the actual actives that were found in the screen. So that's an enrichment of over 20-fold. So we see good enrichment with the bioactive set, and that's to be expected, really, given that its closeness to the training set. We don't see such good performance when we're talking about the more diverse set, and I think there's definitely an area for improvement there, and that's telling us that we really need access to training data sets associated with diverse compound collections in order for us to be able to build better and more improved models. And this is really telling us that the data is not currently available to really understand what we might be able to predict for diverse chemical structures, as opposed to the ones which are already well defined and placed within the public databases in the bioactive set. So next slide, please. So we can actually, if we think about it, what's the real value in the model building that we've done so far? And I think the real value could be that we could be using it in actually defining which compound libraries we'd like to screen. So maybe if you go just back one slide, one thing that I missed, if you go back one slide, if we look at sorry, go down.
The next one, you mean?
Oh yeah, the next one, sorry. Yeah, well, one thing that I missed was that in gram negatives for Pseudomonas aeruginosa, the model for the large library would have predicted no hits. Yeah, so it would have said actually there's likely to be no hits in this screen, and in reality there was only a very small handful of active compounds. So if we had applied that model to that compound set before we done the screen, that model would have said to us it's probably not worth running that screen. And I think the true value of this model is being able to actually define a set of compounds that were most likely to be rich in actives at the onset of screening and coming up with focused subsets of compounds for screening. And I think this is what some of the manufacturers out there are looking to do. So if we look at the next slide, you can see this Enamine, which is one of the major suppliers of compound screening libraries, has a 32,000 member antibacterial library. Now, if we put that library, if you run that through our model, you see that about 90% of those compounds will be predicted to be inactive according to at least the models that we've developed so far. So only 10% of those will be predicted to be active. And of those 10%, if you look in detail in terms of the classes of activity that will be predicted, the majority will be predicted to be active against gram-positive, and a smaller number against Mycobacterium, and then fungi, and then a smaller number again against gram-negative compounds as well. So we see that one of the major application areas for the use of the model could be in that very initial period of screen design, when one is looking to try and identify the optimal set of compounds that should be screened, especially in terms of situations where we're highly resource constrained, for instance. So we're certainly, we already collaborate intensely with Enamine in the context of other projects. We're looking to sort of work with them in more detail to try and understand whether this model might be able to be used to further refine the offer from the Enamine folks with respect to their antibacterial libraries. So next slide, please. So what are the take-home messages from the work that we've been doing within the combined consortia? Well, we started off this work really with the idea of coming up with a database which contained a fair, findable, accessible, interoperable data set for compounds which have shown antimicrobial activities. And we also have sort of within the context of the project itself, internally within the project, we've also been running other compounds, and we're going to make, the aim is, and we have a pipeline to make internal data from within the wider AMR accelerator community also available in a FAIR format and add it to the this publicly available data set on the platform. But we started off with the idea of making FAIR data available. But when you have the FAIR data available, when you've done the work to harmonize, make sure that the data is interoperable, that you apply the consistent set of standards and representations, you can then take that and you can create models from it. And we've shown certainly from the training data sets through a funnel strategy. We investigated a range of ways of representing the properties of the compounds in terms of their structures. And I think we feel that we've identified some important physicochemical properties for which may mediate actual bacterial and fungal activity. The future outlook, I think we need more data. People are always asking for more data. I think we need to add more data, especially for more diverse compounds, which are outside of the current literature reported compounds, and you see that in the discrepancies between the performance against the 100K diversity set versus the bioactive set. So we need more community support in adding data, and that's part of what we're doing within the EU OpenScreen community. We potentially would be able to use the model that we've got to help hone and improve the design of existing screening sets, which are focused upon providing antimicrobial hits and potential in collaboration with Enamine or with other providers of compound libraries for screening. And ultimately, the aim would be able to understand whether we can actually cut the costs associated with the screening of compounds, just focus on those compounds which have a higher propensity and a higher likelihood of actually being active, and which can then be subsequently optimized and then moved through the drug discovery pipeline. So that's something that we could be hoping to do going forward in the future, especially within the context of the EU OpenScreen community. And I think that's the final slide. The next slide is to thank all of the members of the team. Obviously, there was a large amount of experimental data has gone into this, and that's come from Olga Geniu in Fundación Medina, as well as Ursula Bilatevsky at the Helmholtz Center for Infection Research in Germany, and Mark Brunstrop, one of her colleagues there. And we've had additional support from colleagues in North Bristol Trust, Maria Atwood and Maria Kutzikoff, and as well as Frederik as well, in helping us get all our ideas together, and strong support from Anders Carlin and the coordination team within Combine, and all the members of the there's a machine learning group, so that's spread across the different AMR accelerator members, and they've been very helpful in helping us define and refine the objectives of the our machine learning special interest group, so scientific interest group. And also we've had support from Leonie and Axel Paul here in terms of creation of the in silico workflows. So there's a paper which has just been accepted by the Journal of Chemical Information and Modeling. I think the link should be out in the next couple of days or so. That should be able to access that. But otherwise, all of the tools and the resources, the knowledge graph, all of the models, and all the models which work well, and also the intermediate models which didn't work quite so well, those are all available from the GitHub, and they're accessible, as well as the navigator tool shown by Andrea, where you can navigate around it and look at this different structural tree and see all the different compounds in there. So thank you very much, and I think we're ready. If there's any questions, I think Yojana and Andrea and myself will be happy to answer them. Thank you.
Yeah, thanks a lot, Yojana and Andrea and Phil. Fantastic presentation. So from my part, I can only congratulate you with this presentation, and thank you for the nice work. And we hope to see you, of course, in the future as well, with the continuation of your work. So thanks a lot. And thanks everybody for attending. I appreciate it.
Thanks.
Thank you.
Thank you. Bye.
Thank you.